hand. We have been doing that for years and years, and it's been a really effective way to just keep track of who's in the bathroom, what's going on. It's for everyone. It's, you know, we have a lot of clinics here, so it's not just for the people in the needle exchange, it's for anyone who comes in for our services. But again, in thinking about responding as quickly as you can, that's just an example of one way that you can kind of help that happen at the organizational level. And so response plans can be really, really simple. These are the 3 steps. I mean, ideally, this is all that has to happen. You call 911, you give as much information as you can, you give naloxone if you have it, and then you stay with the person until help arrives. If you have other skills or other tools in your toolbox, if you're trained in CPR and you feel comfortable responding with CPR, absolutely incorporate that. We feel as though it can also be a deterrent for some people. And if somebody isn't properly trained in chest compressions or rescue breathing, doing it improperly, you might as well not be doing it at all. So we try to keep our response plan as simple as possible, and say that if you have any of these other skills, absolutely incorporate them for sure. Calling 911 is fairly straightforward. You can really give whatever information you have. Dispatch is quite familiar with this call, and they will ask you if you have naloxone, and they'll help you time your doses, and we're going to talk about what that means in a minute. Make sure the area is clear. If you are in an office or a clinic, make sure you have a plan for crowd control, and then give as much information as you can when EMS arrives. Depending on where you are and what your first responder protocol is like, you might have police officers who carry Narcan depending on where you are in the state. And so response looks a little different depending on who shows up first. If EMS arrives first, the fire department, the medics will oftentimes ask if naloxone has been given and monitor the patient and probably give them oxygen. If the police arrive first and they are carrying naloxone, they will immediately administer another dose. So just know that it might look a little bit different, but still just give as much information as you can and then step out of the way, because once they arrive, they will take over the scene from there and take over working with the individual who needs assistance. We're going to talk about the preparations of naloxone now, and just kind of talk about what each one looks like, but really focus on the one that's most common in our community right now. And I didn't mention this earlier when we were talking about fentanyl and the fentanyl contamination piece, but I did just want to mention that we are seeing an alarming rate of people who report that they are not using opioids, or they're not intending to use opioids, who either test positive for fentanyl when they have a urine tox screen, or experience an overdose and weren't expecting to. So we have had reports of cocaine and crystal meth and counterfeit Xanax and other pills test positive for fentanyl. So it's important that we are providing this education and this information to anyone who we're working with or who's in our life who is using substances, even if they don't report or intend to use opioids. So I wanted to mention that earlier and I got carried away. So these 3 preparations, I would say, are not as common, although the middle preparation, the vials of naloxone and intramuscular syringes, are given out in needle exchange programs all over the state. So again, depending on the population that you work with or what brings you to this training today, you might be very familiar with that type of naloxone. Regardless of the preparation, naloxone is a temporary solution that lasts about 30 to 90 minutes in the person's system, and all that it does is binds to opioids and allows the person to start breathing again. It's extremely safe. You can't hurt anybody by giving it to them. If you mistakenly, if you thought they were overdosing and they weren't, and you gave them naloxone, nothing would happen if they didn't have opioids in their system. And I think that's really important, and we're going to talk about that a little bit more. I'm just trying to keep track of time a little bit too. So the two preparations on either side, the long peach colored box, that was the first intranasal naloxone preparation that we had available to us. And it's actually, it's really a pre-filled syringe that those of us who have been doing overdose prevention work for a long time know that we basically kind of rigged it to be an intranasal naloxone preparation. So it's a pre-filled syringe that then you would also give out these little atomizer nose pieces that would go on top of that little yellow plastic piece and kind of make it into a spray. It took a couple steps and it was a little finicky, so it was not perfect, but it absolutely did the job for a long time. But it's not as common. I haven't seen it in Maine for several years now. The purple and yellow box, those are the auto injectors, which we had a lot of for a long time. It's an intermuscular injection like the vials, and it's this kind of pre-made device that has an automated voice that talks you through the process of what to do. They're great. They were great for a really long time. We handed out a bunch of them. There was a lot of local organizations that handed out a lot of them as well. Unfortunately, the company increased the dosage without kind of telling anyone. So it went from a 0.4 milligram dose, which is consistent with the vials, to a 2 milligram dose, which is a lot of naloxone to be given intermuscularly. And again, as a community of harm reductionists and people doing overdose prevention, we talked this over forever. What are we going to do about the high dose naloxone? Because ultimately, while it's not harmful to give, the higher the dose, the more uncomfortable the person is going to feel when they wake up. Right? So if you think, I'm going to go back to this in a minute, but if you think about the way naloxone works, it's going to bind to the opioids in the person's brain. And what we want is for them to slowly wake up. We want a gentle and compassionate response. When somebody is given a high dose amount of naloxone all at once, they're kind of jolted awake. Oftentimes they feel very uncomfortable. They're basically experiencing withdrawal symptoms. And we know that an overdose can sometimes be a time for an individual to be interested in engaging in some kind of positive change. And so if we are available and responsive and allow that person to wake up slowly and feel safe and supported, maybe that person will be interested in talking more or coming back for other resources or looking into a counseling program or talking to a substance use liaison through the police department. We have all of these various resources that people can engage in. And so we really want to encourage low dose naloxone administration. And so just going back to this type, this is probably the most common nasal preparation that you're going to see. This is the Narcan nasal spray. This is a 4 milligram spray. So it sounds like it's a lot, 4 milligrams versus 0.4 milligrams of the intermuscular, but it absorbs slowly as a spray through the mucosal membranes in the person's nose. The other nice thing about this preparation is there's a really good chance you wouldn't have to give them more. Regardless of what preparation you give, you're going to give one dose and then you're going to wait up to 3 minutes before you determine if the person needs another dose. It's really important that we wait because it doesn't start working immediately. So you're going to give that dose and then you're going to do other things. You're not going to just continue to give Narcan because ultimately we're making a decision for this individual who can't make a decision for themselves. And a lot of times when people wake up after an overdose, they are upset. They have just experienced a trauma and they might not be very thrilled that you just gave them Narcan. Because again, in thinking about how Narcan works, it blocks the effects of the opioids and the person wakes up not feeling those opioids in their system. So for somebody who is a regular opioid user, and for a lot of people that we know that opioids block pain, right? So they block emotional pain really well, but they also block physical pain. And a lot of people that we see have real physical pain, whether it's dental pain or they've been in an injury, or they've been in an accident and they have an injury of some kind, or just life, if they're experiencing homelessness and moving around a lot. So when they wake up from that overdose, all of that pain is there. So we want to be really mindful about only administering Narcan or Naloxone when we have to, when we know that the person is truly unresponsive and needs our assistance, and then we don't give too much. And so this preparation, again, this is the most common that you're going to see. This is what we distribute through the state supply naloxone distribution program. This is available to anyone in this training. Any organization that wants Narcan, we can work with you. But also, please know that anyone can walk into a pharmacy and get this Narcan from the pharmacist using your health insurance. Main Care has great coverage, and if you have private insurance, you can call and find out how much it would cost out of pocket. You can also ask your doctor for a prescription. Anyone in Maine can have Narcan. You don't need to have a history of substance use disorder. You don't have to be actively using. You don't even have to be a friend or family member. Anyone, concerned citizen, member, community organizer, anyone can carry it. So please know that while the state supply is intended to be available for anyone who needs it, there are also other ways that we can access it as well. Another important position to utilize when you are responding to an overdose is the recovery position. And this would be important, especially if you are responding to an overdose alone. So envision this kind of situation. You determine that somebody is unresponsive, you find them somewhere and you're not sure if they're sleeping, but you can tell that they have a needle in their lap and it looks like their breathing is a little bit labored. So you go up, you shake them, you ask them if they're okay, they're not responding to you. You do it one more time. You can even do a sternum rub, which is a really quick and easy way to determine responsiveness. You just rub your knuckles hard and fast on their breastbone right here. This will elicit a response if somebody is just sleeping or if they're passed out because they're drunk or whatever. If they are not overdosing, they're going to respond to this. You can also do it under their nose if you're not comfortable kind of finding this spot on a person. But once you determine unresponsiveness, you pull out your phone, you pull out your Narcan, you call 911 and ask for assistance, and you administer 1 dose of naloxone. I think it's also really important to continue talking to the person, even if they're unresponsive. Hi, my name's Zoe. I'm going to give you some naloxone and call for help. I'm going to stay with you. Please just keep breathing and stay with me. And if I had to leave that person for any reason to go flag down the ambulance or ask somebody for some extra help, I would want to make sure that that person was rolled over onto their side in a way that if they had anything in their mouth or they were to vomit, they wouldn't choke. So sometimes you'll find somebody sort of laying down flat on their back, and just rolling them over either side is fine. Kind of bending their knee and outstretching their arms to support the weight of their body and tipping their head down will help ensure that they're okay and they stay safe if you can't keep your eyes on them the whole time. But I do think continuing to just talk to the individual, especially after you give that dose of naloxone, because that's when you're waiting. And those 3 minutes can feel so long. So giving 1 dose and then staying with the person and talking with them, and just, you can just keep talking, just keep saying your name, keep saying you're okay, because we know that it's pretty common for people to be able to hear us, even if they are unresponsive. And so this is kind of the timeline for where we're at in naloxone access worlds in Maine. And I mentioned that now access is really good, and that's true, and it's taken a long time to get to that, but I think it's really important for those of us who are able to navigate the system of the pharmacy, to try go into your local pharmacy, ask for Narcan nasal spray and see what happens. Because while things are improving all the time, I think we also know that stigma is real, and stigma is what keeps people from accessing care, and it keeps people from engaging in the treatment and recovery that they want. And so those things that we can do that can kind of break down those barriers and break through stigma, I think are things that we can do as community members. And I've had a lot of students that I've worked with at USM and UNE, who have done this, who've gone into their local pharmacy and had a really interesting experience. Some were really great and some were not so great. And then they came back and we talked about that. And that allows me at the state level to do some work around how can we improve pharmacy access. And for anyone who is a prescriber who's on this call, anyone can prescribe naloxone. Narcan nasal spray, it's super easy. You just write it down, 4 milligram spray, and it's available in most pharmacies. And the more prescriptions that get written, the more pharmacies are going to stock it. And then police officers carry it in most of our cities, and a lot of community organizations, like our FQHCs and recovery hubs and treatment centers and counseling services, a lot of places now have naloxone available on site. So if an overdose were to occur on site, and many are also distributing as well. So giving it to patients who are at really high risk. Even if they have main care or they have insurance, if that client or patient isn't going to get to the pharmacy, give them the state supply naloxone. That's what it's there for. A couple of last minute things about naloxone: best kept at room temperature. And now we know that the shelf life for naloxone is 36 months. So there is some naloxone that we still have that has an expiration of 18 months to 24 months, but they just released new information just last week, I believe, that increased that expiration to 3 years, which is great because we've had plenty of reports of people reversing overdoses very effectively using expired naloxone. It's obviously not best practice, and we don't want people to be administering expired medications, but it does happen. And in situations like that, we would just say, please make sure you get more after you use it. A couple other things just to think about on people's radar. The April 2020 National Drug Take-Back Day was postponed, and we're pretty sure the September one is going to as well. In thinking about medications in the home, prescription medications that have expired, or someone got their wisdom teeth out and never took that Vicodin and it's just sitting in your medicine cabinet. I don't know about you, but I've got a lot of kids at home right now. And just in thinking about prevention methods and how we can help keep our youth safe by eliminating or reducing the amount of prescription medications that are kind of laying around. There are prescription drug drop boxes that are available in local police departments. We also made this PDF of how to safely dispose of medications in your home. So please reach out if you want this. We'll share it with everyone who shared their email addresses, but it's a really safe and easy way to just get medications out of the house without you having to leave the house. And lastly, here is my email address. I will happily talk with everyone who wants to stay on for a couple of more minutes after this, but please reach out if you have questions that you'd like to ask just to me directly. And if you're an organization that wants to start training staff and getting Narcan nasal spray out into the community, please reach out and I'm happy to help make that happen. So I'm going to stop sharing my screen and go back to look at all of your faces and see if there are people who have questions, and I have no idea how we're actually going to manage this, but we'll do the best we can. So Ben, if you are there, If you can help me see if people have raise their hand up or just want to get lucky and start talking, whatever is easiest, just make sure you unmute yourself.
So Zoe, my name is George Rowe. I live in West Bayside in Portland. So I'm going to shout out and get things rolling.
Great, thanks.
So, one question, trying to understand the problem, and I'm obviously most concerned about Portland, is most of the overdose data we get is from the Maine Attorney General report. And that is always, there's such a serious time lag. The annual report obviously is often, extremely stale when it comes out 6 months or more after the year is over. So
Right.
I'm just wondering, are you guys able to track real time what is actually happening out, in homes, on the street, in emergency rooms? I mean, is there a reporting system that's robust? For example, I've heard from, sort of rumors on the street, I haven't personally witnessed this, that there were 2 overdose fatalities in and around the Deering Oaks area near the federal post office just in the past couple weeks. And so I'm just wondering, is that news to you guys? Like, are you going to have to wait for the Attorney General to tell you guys about that? Or are you able to know what's happening pretty much as it happens, as law enforcement and, medical providers are reporting to you guys?
That's a great question. And that is something that that we've been talking about locally and at the state level for years. This is the first time in many years that we have support at the state level for issues around substance use and overdose. So it's a new conversation that's happening at the state level, even though many of us locally have been wanting exactly what you're asking for a long time. So I can speak to Portland in that what we have here is an incredible group of community organizations, agencies, and partners who work closely together to share information and data as we're receiving overdose reports. So when I get reports from the needle exchange, when we hear about things through the police department from our substance use liaison, when we hear about peers from Amistad talking, that's information that we're all sharing. What I want and what I hear you saying is that we need a more robust state level, real-time data collection system. And I will say that I sit on the Naloxone steering committee with other representatives from all across the state and representatives from the governor's office. And that is something that is being worked on. Dr. Marcy Sorg, who's our state medical examiner, her team at UMaine is working on what do we do with all this data? We get all of these overdose reports from our clients and needle exchange programs all over the state. And how do we put that into something that's helpful? And so that is actively something that is being worked on and working to create a easy and efficient way to get that information out to the community when appropriate, but also just among community partners and people doing this work so that we can respond and address those concerns accordingly. We do have OD map here in Maine, and so police departments throughout the state report overdoses that come in and get reported to them. The focus right now is getting more people to call 911 to report overdoses, because we still have a lot of people who are choosing not to call 911 to report an overdose. And then we basically hope to capture that data, but we don't always capture that data. So I hear you, and I hope that I can continue to keep the community updated as we continue to work on this, because it's a major area that those of us who do the work want to see happen as well. So thanks for bringing it up.
So there was a question in the chat. If I I can go back to it. Is there documentation available for Narcan expiration information for those of us that have expired on hand, but within the 3-year span?
Sure. Yep. I will include that in the resources that we send out, because the company just sent out a really easy to read one pager. So I'll include that as well.
Another question just came in. So how do we get the nasal spray?
So what I would say is, if you are an individual who wants to get it directly from me, you can email me and I'll ship it to you directly. My team has been doing that since the beginning of March very successfully. The other option, of course, you can try going to the pharmacy or asking your doctor for a prescription. But I'll make sure everyone has my email address, and I'm happy to start shipping Narcan. We'll start doing it tomorrow. We've been doing it pretty easily, and it gets around pretty fast.
Folks asked if you could enter your email address again.
Yes.
Into the chat. Absolutely. And we will send that out when we send the resources to everybody. It will have Zoe's information, how to request Narcan, Naloxone. We'll send information about the recovery hubs, about different programs that you can access to help engage in recovery, about recovery residences. Elizabeth mentioned, I'm not thrilled about going through my own insurance. I think that's a common concern that we hear.
Absolutely. And so I would absolutely be more than happy to have you reach out. And if you're comfortable sending me your mailing address, I'll send you some. I mean, really, the state supply is meant to have no barriers. So if you are comfortable going through your insurance and you are comfortable going to the pharmacy, great. If you're not for any reason and you still want it or need it, perfect. We'll send it to you. It's really that simple. You don't even need to prove it to me. Like, just reach out and we'll send it. Any other questions?
Thank you all so much for joining. Please add your email and name if you'd like a certificate of attendance and a resource list afterwards. Zoe, folks are asking for your email address in the chat. We really appreciate you all taking the time out of your day to attend this training and spend some time with us. Thank you all so much.